Firefighters aren't like any other workers. Their jobs are physically and mentally demanding, and people's lives depend on their ability to perform under pressure. It is more of a calling than a career. Sadly, overexertion on the fire ground is the #1 cause of firefighter injuries. This can be made worse by firefighters who are out of shape, have poor diets, or have not been appropriately treated for medical conditions. Successful wellness programs can be key in preventing firefighter injuries. Sometimes, however, despite their training and abilities, firefighters get hurt. How do departments create a successful early return to work program? As a first step, departments can create a thorough job analysis that lays out the essential physical and mental health requirements of frontline firefighting and EMS duties. Next, departments can make a list of meaningful light-duty jobs for either 8-hour or 24-hour shifts. These can include things like administrative tasks, inventory, public outreach, PPE inspection, building inspection, SCBA fit testing, and tool maintenance. The job analysis, light-duty job descriptions, and required forms for early return to work can then be put in a department standard operating guideline and communicated to the department. At times, a fire department can work with a vocational rehabilitation counselor to complete job analysis, identify meaningful light-duty jobs, and document and build skills of injured firefighters. So let's pick this up again at the point the firefighter gets injured. At the hospital or clinic, the firefighter fills out the report of accident form and starts the claim process. After evaluating the firefighter, a healthcare provider must determine if the firefighter's injury will keep them from being able to perform frontline firefighting tasks. With certain injuries, a firefighter may be able to stay on the job while recovering from an injury by performing non-critical tasks. The healthcare provider will ultimately have to decide what the firefighter can or cannot do and specify requirements on an activity prescription form, or APF. The firefighter may also be in physical therapy while in recovery. The physical therapist should also have access to the full duty and light duty job analysis and the activity prescription form while helping the firefighter get back to fit for duty status. The goal of physical therapy should be to specifically get the firefighter's abilities to match full duty job analysis essential tasks. In other words, getting the injured firefighter back into frontline firefighting condition. Why go through all the paperwork? Why not just let our firefighters rest at home? They deserve some time off, right? Actually, it's not good for the firefighter to recuperate at home. The longer an injured firefighter is out of work, the more likely it is they will never return to work. Without their calling, most firefighters flounder emotionally and eventually financially. Firefighters who have extended time off work need retraining, but having them stay active on the department helps them keep up with required training. It also keeps them connected with their team. The camaraderie is a positive factor in their recovery. Also, departments suffer financially when a firefighter is missing workdays recovering at home. Workmen's compensation rates increase for the entire department. In fact, for the entire fire service. Putting a firefighter on light-duty projects actually saves the fire department money. There is bonus money for departments by using L&I's Stay-at-Work program. The program pays departments 50% of light-duty wages paid for up to 66 days, $10,000 maximum. The Stay-at-Work program also pays up to $2,500 maximum for equipment and modifications. Getting reimbursed from the Stay-at-Work program for qualifying fire departments is easy. Departments have up to a year after an injury to apply for funds by logging into their Secure Access account and submitting the Request for Wages Reimbursement, or Request for Equipment Reimbursement form. They will need to supply timesheets, payroll records, and receipts for equipment purchased to facilitate a light-duty worker. Washington fire chiefs have put significant time and effort into developing the forms, tools, and training to make your department's early return to work program successful. Come see our website to help design your department's program.